Your doctor prescribed a metered dose inhaler and a spacer device to use with your inhaler. It is important that you know how to use your medicine the correct way. A spacer is a special device to use with your inhaler. Spacers increase the amount of medicine that goes into your lungs. This can help your medicine work more effectively and, in turn, help you manage your lung disease better. Better disease control can also mean less frequent use of your fast-acting rescue inhaler. The spacer has 3 parts: an adapter, the chamber, and a mouthpiece. The elastic adapter at the back of the chamber allows patients to use inhalers of varying sizes with their spacer. The elastic adapter should form a good seal around the mouth of the inhaler. If you find you do not have a good seal, let your doctor or pharmacist know. A different spacer may be more effective for your inhaler. Next is the anti-static chamber where the medicine flows. Within the chamber, medicine stops at a valve that opens when you breathe in deeply through the mouthpiece. Some spacers have a mask where the mouthpiece would be. These spacers work in the same way. Learn how to use your spacer. 1. The first step is to remove the caps from both your inhaler and your spacer. Look inside both to make sure you do not see any foreign object. 2. Prime your inhaler if it is the first time you are using it or if you have not used it for over 14 days. Each type of inhaler is different. It is important to read the information leaflet that comes with your inhaler. We recommend you spray the inhaler 2 to 4 times away from your face. The action of priming is important to ensure you get the right amount of medicine per dose. 3. Shake the inhaler so the medicine mixes with the propellant. If you do not shake the inhaler, you will get more propellant than medicine when you inhale. 4. Attach the mouthpiece of the inhaler to the elastic adapter at the back of your spacer. 5. Stand or sit upright. Tilt your head back and breathe out gently. Wrap your lips around the mouthpiece without biting down. A. It is important to hold your inhaler like this, so it is straight and not like this. 6. Single breath technique. A. Take a slow, deep breath. B. As you begin to breathe in, press the inhaler canister down as you continue to inhale. C. Remove the spacer from your mouth and hold your breath for 5 to 10 seconds, or as long as is comfortable. D. Breathe out gently. 7. Tidal breathing technique. A. Take a slow, deep breath. B. As you begin to breathe in, press the inhaler canister down. C. Breathe in and out normally 3 times through your mouth if your spacer has a mouthpiece. Breathe in and out normally 5 times if your spacer has a mask. D. Remember, you do not need to hold your breath at the end of this technique. 8. If you hear a whistling sound or the sound of a harmonica, you are inhaling from the spacer too fast. Slow down your inhalation. 9. If you need to take another dose, repeat the whole process again after 30 to 60 seconds. 10. After using the inhaler and spacer, replace the cap on both. Cleaning instructions. Wash the spacer once a week by soaking in lukewarm water with a small amount of mild detergent added. Soak for 15 minutes. Rinse well. After washing, allow the spacer parts to air dry in a vertical position. Do not dry using a cloth. Cloth drying can cause static within the spacer chamber. Static can make medicine stick to the sides of the chamber, and you will not receive your full dose of medicine. Replace your spacer with a new one every 6 to 12 months.